Magical properties of everyday foods, healing properties, and how to use them. Welcome to my channel. Today, we embark on a captivating journey into the world of magical properties of everyday foods, healing properties, and how to use them. Discover the awe-inspiring secrets hidden within your kitchen and unlock the mystical potential of ordinary ingredients. But before we dive into this wondrous adventure, remember to hit that like button and subscribe to join our magical community. Number 1. Chamomile. Chamomile is a well-known herbal remedy that has been used for centuries for various medicinal purposes. It is derived from the dried flowers of the chamomile plant and is commonly consumed as a tea or applied topically as a compress. While chamomile is generally considered safe by the U.S. Food and Drug Administration, FDA, it is essential to be aware of its potential benefits and interactions with medications. Some of the common uses of chamomile in the U.S. include its role in promoting relaxation and reducing anxiety. Many people find chamomile tea to be soothing and helpful in calming nerves. It is often used as a natural remedy to help with sleep and to ease feelings of stress and tension. In Europe, chamomile is traditionally used for wound healing due to its anti-inflammatory and antimicrobial properties. It is also believed to reduce swelling and promote faster healing of minor wounds. Number 2. Echinacea. Echinacea is commonly used to treat or prevent colds, flu, and infections, and for wound healing. Many studies have looked at how well echinacea works to prevent or shorten the course of a cold, but none were conclusive. Some studies do show some benefit of using echinacea for upper respiratory infections. Short-term use is advised because other studies have also shown that long-term use can affect the body's immune system. Always check with your healthcare provider about any interactions with medicines that you are already taking. People allergic to plants in the daisy family may be more likely to have an allergic reaction to echinacea. The daisy family includes ragweed, chrysanthemums, marigolds, and daisies. Number 3. Feverfew. Feverfew has a long history of use in traditional medicine for treating fevers, hence its name. In more recent times, it has gained popularity as an herbal remedy for preventing migraines and managing arthritis. For migraines, some research has indicated that certain preparations of feverfew can be effective in reducing the frequency and severity of migraine headaches. However, it's essential to note that individual responses to herbal remedies can vary, and not everyone may experience the same benefits. As with many herbal remedies, feverfew may have side effects. Chewing feverfew leaves can lead to mouth ulcers, and some people may experience digestive irritation when using it. Moreover, suddenly stopping the use of feverfew for migraines may cause headaches to return or worsen, which is sometimes referred to as rebound headaches. To avoid this, it's advisable to gradually reduce the dose of feverfew under the guidance of a healthcare professional. Number 4. Garlic. Garlic, Allium sativum, is a widely used herb in cooking and traditional medicine, and it has been studied extensively for its potential health benefits. Garlic contains several biologically active compounds, including allicin, which is believed to be responsible for many of its therapeutic properties. The medicinal properties of garlic are diverse, and research has shown that the compounds isolated from garlic have antimicrobial effects, meaning they can help combat certain infections. Additionally, garlic is believed to have cardioprotective properties, as it may help lower cholesterol levels and blood pressure. Some studies have also suggested that garlic's bioactive components could have anti-cancer and anti-inflammatory effects. The U.S. Food and Drug Administration, FDA, has classified garlic as generally recognized as safe grass, which means it is considered safe for consumption in moderate amounts as a food ingredient. Number 5. Ginger. Ginger is a popular herb that has been used for its medicinal properties for centuries. It is most commonly known for its ability to ease nausea and motion sickness. Ginger contains active compounds such as gingerol, shogol, and zingerone, which are believed to be responsible for its therapeutic effects. The use of ginger to relieve nausea caused by various conditions is well established. Research has shown that ginger can be effective in reducing nausea and vomiting associated with pregnancy, morning sickness, and chemotherapy-induced nausea. It is considered safe for pregnant women when taken in moderate amounts. But as with any supplement or herb, it's essential to consult a healthcare professional before using it during pregnancy. It's important to note that while ginger is generally considered safe for most people when used in moderate amounts, it may interact with certain medications or have adverse effects in some individuals. Number 6. Ginkgo. Ginkgo leaf extract has been used to treat a variety of conditions such as asthma, bronchitis, fatigue, and tinnitus. It is also used to improve memory and to prevent dementia and other brain disorders. Some studies have supported its slight effectiveness, but exactly how ginkgo works isn't understood. Only extract from leaves should be used. Seeds contain ginkgo toxin. This toxin can cause seizures and, in large amounts, death. Because some information suggests that ginkgo can increase the risk of bleeding, it should not be used with nonsteroidal anti-inflammatory medicines, anticoagulants, anticonvulsant medicines, or tricyclic antidepressants. Number 7. Ginseng. Ginseng has been touted for various potential health benefits, including its use as a tonic, aphrodisiac, and even a cure-all. However, research on ginseng's effectiveness has yielded mixed results, partly due to the difficulty in defining and measuring vague concepts like vitality and quality of life. One significant challenge with ginseng is the large variation in the quality of products available on the market. The potency and efficacy of ginseng supplements can vary widely depending on factors such as growing conditions, harvesting methods, and processing techniques. Number 8. Golden Seal. Golden Seal is used to treat diarrhea and eye and skin irritations. It is also used as an antiseptic. It is also an unproven treatment for colds. Golden Seal contains berberine, a plant alkaloid with a long history of medicinal use in both Ayurvedic and Chinese medicine. Studies have shown that golden seal is effective for diarrhea, but it's not recommended because it can be poisonous in high doses. It can cause skin, mouth, throat, and gastric irritation. Number 9. Milk thistle. Milk thistle, Silybum marianum, is a plant that has been used for medicinal purposes for centuries, especially for liver-related issues. The active component in milk thistle is called silymarin, which is believed to have antioxidant and anti-inflammatory properties that can potentially benefit the liver. Traditionally, milk thistle has been used to treat various liver conditions such as cirrhosis, hepatitis, and liver damage caused by alcohol or other toxins. It is also thought to have cholesterol-lowering effects, and some studies have explored its potential in reducing the growth of certain cancer cells. It is essential to remember that while natural remedies like milk thistle can have potential benefits, they should not replace standard medical treatments or professional medical advice. If you have liver issues, high cholesterol, or any health concerns, it's essential to consult a healthcare professional for proper diagnosis and appropriate treatment options. Number 10. St. John's wort. St. John's wort is a popular herbal remedy used as an alternative treatment for depression. Several studies have shown that it may have a small positive effect on mild to moderate depression over a period of about 12 weeks. However, its effectiveness for severe depression remains uncertain, and it is not considered a first-line treatment for major depressive disorders. One significant side effect associated with St. John's wort is photosensitivity, where individuals taking large doses of the herb may become more sensitive to light. This can lead to sunburn or skin irritation when exposed to sunlight or ultraviolet (UV) light. It cannot be emphasized enough that individuals considering the use of St. John's wort or any other herbal supplement should always consult their healthcare provider before starting the treatment. This is particularly important for those who are already taking prescription medications or have underlying health conditions. If this journey into the magical properties of everyday foods has sparked wonder in your heart, be sure to show your love with a thumbs up and join our vibrant food-loving community by subscribing to our channel. We can't wait to hear from you in the comments below.